Do statins really stop heart attacks? Or are millions of people taking a pill that doesn't do what they think it does? Every day, doctors prescribe statins to lower cholesterol and protect the heart. But the real question is this: how much protection do they actually give? In this video, we'll separate facts from assumptions. No fear, no hype, just clear answers by the end. Statins are medicines that lower cholesterol in the blood. Doctors mainly prescribe them to reduce LDL, often called bad cholesterol. They are commonly given to people with high cholesterol, diabetes, or a history of heart disease. Some people take them after a heart attack. Others take them to reduce future risk. They don't fix the heart overnight. They work slowly over time by changing how the body makes cholesterol. In medicine, prevention does not mean zero risk. It means lowering the chance of something happening. Statins help more in people who already had a heart attack. This is called secondary prevention. They can also help some high-risk people who never had one. That's primary prevention. But the benefit is smaller. Statins reduce risk. They do not erase it. Expectations matter, because misunderstanding leads to disappointment. Effect number 1. Lowering LDL cholesterol. LDL is often called bad cholesterol, but most people don't know why. LDL particles travel through your blood and can stick to artery walls. Over time, they build layers, like dust inside a narrow pipe. This makes it harder for blood to flow. Statins lower LDL by slowing down cholesterol production in the liver. When the liver makes less cholesterol, it also pulls more LDL out of the blood. This matters because high LDL is one of the strongest risk factors for heart attacks. Lower LDL means fewer particles crashing into artery walls every day. But here is the truth many miss. Lowering LDL does not clean arteries overnight. It reduces future damage. Think of it like stopping smoke from filling a room. The air slowly improves, but the damage already done doesn't disappear instantly. That's why statins work best when taken consistently and early enough. LDL reduction is not dramatic. It is gradual, quiet, but over years, it changes the direction of risk. Effect number 2, plaque stabilization. Plaque is not just cholesterol. It's a mix of fat, calcium, and inflammatory cells stuck inside artery walls. The most dangerous plaque is not the biggest one. It's the unstable one. Unstable plaque can crack suddenly. When that happens, the body forms a clot. That clot can block blood flow to the heart. This is how many heart attacks begin. Statins don't just lower cholesterol. They help make plaque more stable. Over time, plaque becomes less likely to rupture. Think of it like a weak wall turning into solid concrete. The plaque may still be there, but it's calmer and less reactive. This effect is one reason statins help people who already had heart attacks. They reduce sudden surprises inside the arteries. This benefit is quiet. You won't feel it. There's no symptom. But inside the body, risk slowly drops. This is prevention that doesn't announce itself. And that's why many people underestimate it. Reduced inflammation. Inflammation is the hidden fire inside blood vessels. It doesn't hurt. You can't feel it. But it plays a major role in heart disease. When arteries stay inflamed, plaque grows faster and becomes unstable. Inflammation also makes blood more likely to clot. Statins help calm this process. They reduce certain inflammatory signals in the body. This effect is separate from cholesterol lowering. Even people with normal cholesterol may benefit from this anti-inflammatory action. Less inflammation means calmer arteries, smoother blood flow, lower chance of sudden blockage. This is why statins sometimes help more than expected. They are not just cholesterol pills. They change how blood vessels behave. However, inflammation does not come from nowhere. Poor diet, smoking, stress, and inactivity all feed it. Statins can reduce the fire, but they don't remove the fuel. That's why lifestyle still matters. Medication can calm the system. Habits decide how loud the fire keeps burning. Effect number 4, side effects. Many people don't expect statins are generally safe, but they are not perfect. Some people experience muscle pain or weakness. It can feel like soreness that doesn't go away. Others report fatigue or mental fog. These effects are real, but they don't happen to everyone. Many people take statins for years with no issues at all. The problem is expectation. Some are never told side effects are possible. Others are scared into stopping medication without medical advice. Both are mistakes. Side effects often improve with dose changes or switching statins. Sometimes symptoms are unrelated but blamed on the drug. The key point is balance. Fear should not guide decisions. Blind trust shouldn't either. If symptoms appear, they should be discussed, not ignored or dramatized. Statins are tools, not villains, not miracles. Understanding risks makes them safer, not scarier. Effect number 5. Who benefits the most? Statins help some people more than others. The biggest benefit is seen in people who already had a heart attack or stroke. In these cases, statins clearly reduce future events. High-risk individuals also benefit. This includes people with diabetes, very high LDL, or strong family history of heart disease. But for low-risk people, the benefit is smaller. Some may never experience a heart attack even without statins. That doesn't mean statins are useless. It means medicine should be personal. Risk matters. Age matters. Lifestyle matters. Taking statins just in case is not always necessary. This is where confusion begins. One-size-fits-all thinking doesn't work in heart health. The right decision depends on risk, not fear. That's why informed conversations matter more than internet opinions. Statins are not a magic shield. They don't cancel poor diet. They don't erase smoking. They don't replace movement. They lower risk. They don't eliminate it. The biggest mistake people make is thinking medication alone is enough. The strongest protection comes from combining habits with medicine. Better food, regular walking, stress control, sleep. Statins work best in a healthy environment. Think of them as support, not rescue. When habits and medication work together, risk drops the most. When they don't, disappointment follows. The truth is simple. Pills help. Choices decide. Statins can lower risk, but they don't replace smart choices. The real power comes from understanding your body, knowing your risk, and making informed decisions with your doctor. If this video helped you see statins more clearly, give it a like, share it with someone who needs clarity, and subscribe for more simple, honest health explanations.